Awesome. All right. Well, hello and welcome. We are so excited to see so many faces at our FESTA program outreach event, our Lunch and Learn with some amazing panelist members. So my name is Dr. Kelly Clary, and I am an assistant professor in the School of Social Work at Texas State University, and I am serving as the project director of the FESTA program. FESTA standing for Fentanyl Education Support Training Awareness. And this project is funded through SAMHSA, the Substance Abuse and Mental Health Services Administration. And we received funding for 5 years to support Hays County in reducing fentanyl poisonings, fentanyl overdoses, and we are doing various activities to support that goal. So we are doing educational curriculum for 6th through 12th grade students in response to Tucker's Law. We are also engaging in outreach events for adults throughout Hays County, and this is one of these events. And then we are also leading various trainings, including Narcan trainings. So again, we're really excited that y'all are here. You all are here for a reason, and we hope that you'll find this time together valuable. A little bit more about the FESTA program is that we have partnered with 4 community agencies, Texas ICON, which stands for Integrated Community Opioid Network, Senate Corps, Hill Country MHGD, as well as the Hays County Sheriff's Office. And we've also partnered with 2 school districts, Wimberley ISD and Dripping Springs ISD. So I want to be very mindful of our time together. So our agenda today is I'm going to turn it over to our panelists to introduce themselves. We then have 8 questions that we'll have the panelists answer, and then we have some time at the end for questions from you all that we'll get to. And then I will ask y'all to voluntarily participate in a post survey to give us some feedback on this event and give us some ideas for other events, activities that you all would like to see throughout Hays County. So without further ado, I'm going to go ahead and turn it over to Dr. Ty Shepis to start with introductions.
Hi, everyone. I am Ty Shepis. I'm a professor in the Department of Psychology at Texas State University. I'm a member of the FESTA program on the grant as sort of a area specialist for adolescent and young adult substance use. My area clinically and research-wise is particularly on prescription drug misuse. So opioids, including fentanyl, and then prescription stimulants. And again, I'm a member of the program as sort of a content area expert.
Thank you, Dr. Shepis. I'll turn it over to Dr. Andrea Yatsko.
Good afternoon, everyone. My name is Andrea Yatsko. I am an assistant professor at UT Health here in Houston, and my role currently is working as the director of operations on a variety of projects and programs that we have over here, including our Heroes program and Project Icon, which are forward-facing programs, both with kind of varying elements of community outreach and awareness, education, as well as certain elements of direct patient care, connection to services, and I work with a multidisciplinary team made up of peer recovery coaches, counselors, case managers, prescribing physicians, and all of us kind of collectively work together to support individuals living with substance use disorder.
Thank you. And I'll turn it over to Crystal to introduce themselves.
Hello, everybody. My name is Crystal Walsh. I'm a peer support specialist with the UT Health Heroes Icon program. In this role, I collaborate with the Houston Fire Department on assertive opioid overdose outreach. I facilitate and coordinate peer recovery support groups and provide person-centered support for individuals pursuing long-term recovery from opioid use disorder and substance use disorder. I also manage referrals to vital community services and advocate within criminal and family court systems. I coordinate calls for the UT Health Helpline Project, which supports first responders and healthcare workers in the state of Texas seeking treatment. As a person within long-term recovery from opioid use disorder, I also bring my lived experience to my work, including my personal journey with medication for opioid use disorder and its transformative impact on my personal recovery. And I also find passion in educating the community about fentanyl awareness, medication for opioid use disorder, and harm reduction strategies. Harm reduction is an evidence-based approach aimed at minimizing the negative health, social, and legal impacts associated with substance use disorder. Instead of focusing solely on abstinence, harm reduction strategies meet individuals where they're at in their substance use journey. And a perfect example of harm reduction is naloxone training. Also, I share my lived experience to aim for hope and to foster connection in the recovery community.
Thanks so much, Crystal. I'll turn it over to Deborah Antic to introduce herself.
Hey guys, Deb here. I am a person let's see. Okay, I am a person in long-term recovery from co-occurring, and so that includes mental health. I am a recovery support peer specialist working with ICON, also working with Texas State, uh, working on that curriculum in reference to Tucker's Law. I also support communities. I travel all over the state of Texas, and I connect with communities where they are. I help people in real time, real space, answering real questions. So that's what we're all here to do. We want to answer questions in ways that you guys can understand. And we're all here together. We're all here learning together. So I also consult all over the country with the Opioid Response Network, and I also consult with recovery organizations. And now companies are asking for this help. And so that's something really exciting that's happening now. So, all right, that's me.
Thank you, Deb. And I will turn it over to Ashley Mackey to introduce herself.
Can you hear me, everyone? Okay. Hi, my name is Ashley Mackey with the Houston Fire Department. I'm an EO engineer. I also do community paramedicine as well as assertive outreach with UT Health Houston Heroes Icon Project. I've been at this for about 5 years with UT Heroes, and thank you all for being here, and thanks for letting me be here.
Thank you so much. So those introductions were amazing. We have some absolutely phenomenal panelists who are here with us who bring years of experience, expertise, and knowledge to share with you all. So I am honored that you all have agreed to, spend your time with us and to educate, inform us about fentanyl, and then leave us with some ideas or some activities to support our community and to support others who might be struggling with substance use, with opioid use disorder, and to become more knowledgeable about this topic. So we are so grateful for all of your time and all of the incredible knowledge that you are going to share over the next 45 minutes. So we have 8 questions for our panelists. And we have about 3 minutes for, the questions so that we can make sure that if the audience has questions, they can share those with us. Feel free to drop questions in the chat as we're going so that you don't forget them. But we should have about 10, 15 minutes at the end to answer those questions. And if we don't have time, we'll make sure that we connect with you to get them answered. So my first question is for Ashley. And Ashley, this is kind of a 2-part question, so I'll put it, I'll share both of those questions. So the first part is, can you share what fentanyl is and what makes it so dangerous compared to other opioids? And then that follow-up question to it is, how are students, how are youth unknowingly coming into contact with fentanyl?
Okay. Fentanyl is a beautiful, terrible drug or medication. Just some statistics about it. It's roughly 100 times more potent than morphine and 50 times more potent than heroin. So therein lies the reason why it can be so dangerous. Aside from that, the amount that's required to cause an overdose or the effect that's needed, even when under a doctor's care, is so small and tiny that it can make a huge difference from basically a person living and thriving to being no longer here. So that's the first part about it. It is a Schedule II medication or Schedule II drug, which means there is a medical necessity for fentanyl, but that once again, that's under a doctor's care or a paramedic or someone in that arena. It is widely administered and used in those arenas for traumatic events like broken bones and things of that nature. Cancer breakthrough pain, that's what it's supposed to be used for, but every day it's not really used and there's no medical necessity for it. Now, it is being made in different places and it does come in through various ports. A little bit is even produced here, and that's where the issue lies. So you can get it anywhere in gummies, for example. Lots of people like gummies. Um, People in schools, they have friends who um, say, here, try this gummy. Fentanyl can be in that. Um, Also, it can be airborne. It's not really airborne too much if it's not quote unquote pure, but that also can happen. So it can be breathed in. It's not a lot of people have that done, but it is a possibility. So did I answer both questions?
Yeah, and I'll turn it over to the other panelists if there's anything that you all want to add. We have about a minute or so to add anything to what Ashley shared.
Just in response, Gabriella, I see like your face is like, oh wow. The places where it is usually breathed in is going to be more like where there are larger amounts of fentanyl, like maybe where it's being made. It's so I want to go back to what Ashley said and just say, it can be breathed in. The chances are going to be pretty unlikely
That's
that like somebody will be breathing it in unless they are in a space where a lot of fentanyl is present. So I wanted to just speak to that a tiny bit.
great.
Thank you, Deb. All right, we'll move on to question 2. So this is for Andrea. My question for you is, what trends are we seeing regarding the fentanyl crisis? When we think about the nation, specifically in Texas, and if there's any other counties throughout Texas that maybe are seeing higher numbers or higher statistics, if you can speak to that.
Absolutely. So generally speaking, we're kind of in what we call the fourth wave of the opioid epidemic. So it started way back in the early 2000s with the prescription opioids being kind of, widely available and, kickstarting a lot of this. Then we tamped down on that, and then that's where the heroin kind of started to take and fill that space. And then it started to be, the readily available and the thing that was really driving this epidemic. And then phase 3 was when synthetic opioids started to be kind of introduced into the market and really saturating everything that's going on out there. And so this is where things like fentanyl started to arise and play a role. And then phase 4 really is where fentanyl and stimulants have just kind of completely overlapped, and it's very unlikely you're getting one without the other. So we're kind of in this space where now that pervasiveness of, the synthetic opioid is literally kind of in everything out there. So it's not like opioids over here and all these other substances over there. There's just been kind of this meshing of everything that's going on out there, and fentanyl is just kind of blanketed any of the illicit landscape. And we know that based on, drug seizures and toxicology reports and things like that, where we've been able to collect the trends of what is happening out there. And when it comes to Texas specific, we are not the greatest with data in Texas, so we do what we can to kind of figure out what's going on out there. The reality is in a lot of ways, we're no different than any other state out there. We have it just as pervasive. We have a lot of concerns within our state specifically because of our coastal areas and our proximity to the border. So we are considered a high intensity drug trafficking area. So we have have a lot of these ports and entries for things to be able to get into our state. We're doing a little better in trying to track overdoses and, both fatal and non-fatal, but we still fall behind when it comes to official statistics. So we're playing catch up in trying to really understand how pervasive and problematic it is within our state. But the reality is it's very much within our state. It's very concerning within our state. Anyone who is working in this space as boots on the ground truly understands just how problematic fentanyl has really made our landscape and how concerning, and then especially, of course, from the fatalities that go along with that.
I appreciate that. Is there anybody else who wants to add anything to what Andrea shared? Okay. So Andrea, I have a follow-up question to that. What are the biggest misconceptions or myths about fentanyl that are maybe pushed in social media or just due to not knowing or not being educated about fentanyl that we can talk about to make sure that the facts and the truth about fentanyl are being shared and awareness is brought to it?
Absolutely. I think the most important one kind of got touched on a little bit by Ashley and Deb regarding like trace contact with it. I think it's a very fine line there of being mindful about like, yes, absolutely. It is something in very, dense areas, most likely where something's being manufactured or a lot of it is present, it can be inhaled and you can see a measurable response to that. But generally speaking, trace contact is not a realistic concern. And we want to make sure that we put that out there. So when it comes to if you're like, oh, someone might be overdosing, or I don't want to get near them with naloxone to help reverse an overdose, or I'm scared to respond. I think there's, sometimes that stigmatizing fear that gets out there that is not based in fact or reality about the likelihood of any of that being kind of transferred or getting on your clothes or things like that is not a realistic concern out there. It's not backed by science or medical research or evidence. And so we want to just make sure that there's not a fear of intervening or working with patients with either fentanyl use disorder or opioid use disorder. You're not going to catch it. You're not going to get too close to them. It's not going to be transferred from shaking a hand or passing a towel or anything like that. So I think that trace contact myth is just really important to highlight as one of the most important ones. Other things out there, just that, and we touched a little bit on the waves that are happening out there. Fentanyl doesn't just affect persons with opioid use disorder. It can affect anybody with any type of substance use disorder. If you're getting anything illicitly off the streets, there's a very high chance that it has fentanyl in there, and it doesn't matter if it's just pressed pills or opioids, or you think you're getting heroin, or you think you're getting something else, like, or maybe you think it's a methamphetamine. I mean, the reality is fentanyl's kind of blanketed everything that's out there. And so it's very hard to kind of isolate. And there's kind of that catch of, like illicit substances don't come with an ingredients list. Like you don't know what's in there, but the high likelihood is it's got fentanyl in there. And we see that a lot just working in the patient care with toxicology screens post, entering treatment. And they're, here's the things you're positive for. We're like, well, I'm not taking that. And it's like, but you are. And so there's a lot of just, kind of just false sense of I know where it comes from, or I know my dealer, or I'm comfortable of I've taken it before, it's fine. And the reality is it's very pervasive out there. It's in everything, and you don't know what you're actually putting into your body. I mean, so those are the two big ones. I'll pause there in case anyone else wants to chime in on any myths.
Deb, I saw you unmuted yourself.
Kelly's like always like, oh no, Deb unmuted herself. But the one thing that I want to say is that, I hear a lot in my drug offender classes that, well, I know my dealer, like I know who I'm getting it from, but you don't know who they're getting it from. And you don't know who they're getting it from. This is really like a hierarchy. You might know this person or you might know this person, and it might actually be your friend. It We see this a lot, especially with youth, that, a kid might get an Adderall from a friend that they know has an Adderall prescription, but their friend has already gone through their Adderall prescription. And what they're actually doing is they're buying what they think is Adderall on the street. And you're going to see some of that cross contamination there where they think it's an Adderall, but they might be getting fentanyl, and it might be in very low doses in one pill where it can be in a very high concentration in another pill. And so that I go back to that all the time. If you are not getting a medication from a prescription bottle that you received from your medical professional, you do not know what you are getting. And that's, we also talk about street drugs. Kids don't think about a pill that they're getting from a friend as a street drug because that's their friend. So that's another thing that we just want to get across as well. Is just that, there's this us and them kind of way of looking at things. Like, well, street drugs are over there. This is my friend from school. There's a lot of overlap in those places right now, you guys, and we're really wanting to get that message out.
I appreciate that, Deb. All right. So, regarding messaging, this I think transitions into the next question regarding social media. So, Crystal, I would like for you to share, how has social media played a role in fentanyl exposure among youth?
Well, social media has become just an integral daily part of pretty much most young people. Platforms like Instagram, Snapchat, TikTok, are not only used for socializing, but they become channels for drug dealers to market and sell their counterfeit prescription drugs such as fentanyl. The anonymity and wide reach of these platforms, it makes it easier for drug dealers to target young users, which causes, significant risk to their health and their safety. Social media provides a convenient and discreet way for youth to access drugs, and dealers are using coded language such as emojis to advertise their products, which makes it hard for parents and even authorities to detect these activities. The accessibility means that the drugs can be obtained with just a few clicks, often without the buyer even fully understanding the dangers involved in what they're purchasing on these social media platforms. And so there's also a lot of influencers, on TikTok and Snapchat. And so they kind of normalize substance use for the youth. And when young people see their peers and their influencers using their drugs, it kind of lowers the perceived risks that are involved, and it also increases their curiosity. And so by normalizing it, it's particularly concerning because it can lead to experimentation and potentially dangerous behaviors that can result in fatality because of the fentanyl exposures. And so there are studies that show that teenagers who regularly use social media are more than likely to engage in substance use compared to those who use it less frequently.
Thank you, Crystal. Deb, I saw you unmuted yourself. Did you want to add anything to that?
I Here's a piece to that using social media that I've really started to try and get across to parents, which is if your kid is spending the majority of their time on social media, you might be too. And we are seeing a lot of like phone use with adults and parents. And this speaks back to just like this disconnect, even within households where you've got four people in a house in four different rooms using social media in four different ways. And so, especially with working with the community, my big message is have some time that you don't have your phones on you, that you are connecting as family, as friends, having some social media free times. And it's hard. I mean, I have two kids, and, asking one of them, especially, it's like asking them to not be on their phone is a lot. But being able to do it in small increments, it's really beneficial just for people and families to get to know each other again. And so, like parents, if you're like, my kid is always on their phone, think about how much you're on your phone. And this is going to be some of that, like holding the mirror up. Like, we all have to do this because we all need to reconnect again.
I appreciate that, Deb. And that leads me, I think, into the question for you, which is, what are some best practices or approaches that could help reduce fentanyl related deaths? And then if you can kind of talk more about, the most effective harm reduction strategies that, we can engage in to prevent fentanyl overdoses.
So I love that we're in this place right now that we are really talking about substance use. Not in a way of like, just don't do it, because that's never worked, right? We need to really be realistic that kids, their brains are not fully developed. They are going to try things, whether it's, jumping a dirt bike off of your roof or, trying something that someone is saying to them at like they see their friend take something and then they might feel like, oh, that's kind of a doorway to take something myself. Again, just being able to have these very open conversations with our kids, not saying like, oh, you're not using drugs, are you? Right, right. You're not using drugs. So, right. Yeah, right. Guys, we need to really have those discussions of like, what does this look like? If your kid is afraid to talk to you about anything, they're sure not going to open up to you that they are using something or that they have become addicted to a substance that they did not even know that they tried to begin with. So, one of the things that I want to say about fentanyl is that some people can get addicted very quickly because of things like genetics, because of things like past trauma. Like somebody can take something that almost like completes them. I've heard this in my drug offender classes. Somebody met heroin and they were like, it completed me. If your kid is one of those kids, or your uncle, your sister, your mother, your brother is one of those people, they can stumble very quickly into addiction without even understanding why. And so um, that goes back to that brain not being fully developed. And if somebody is introducing a substance, any substance, even including things like alcohol, cannabis, it that is going to change their brain development. Okay, like so. I hear people say all the time, I just want my kid back, Deb. As a recovery support peer specialist, like I am able to still work with people, meeting them where they are. They can still be using, and me and Crystal, we can still be working with them, helping them. And so seek out supports. If you feel like you might have a loved one that is struggling with use, and I'll tell you, there are a lot of people that appear to be funding that are struggling with substance use. Okay. I mean, your coworker. So some of the things that we can talk about when it comes to harm reduction is, again, knowing where people are. For me, I always have when my kids were younger, I always knew where they were going. I always knew who they were with, at least so that I had those people's phone numbers. I had very close connections with a lot of the people that they hung around with. And if they weren't hanging out with those people, that was telling me something is going on here that I might need to dig into. We have to have those very difficult questions. We have to have those conversations. And it's not a one-time conversation, you guys. It's ongoing.
I appreciate that, Deb. Oh, go ahead, Ashley.
In the case that something adverse does happen, even after all the speaking and things like that, once 911 is called, we do come on scene, and the first thing we use is Narcan. Narcan is something that can be easily gotten through UT Heroes through lots of outlets. So I would ask everyone, if you don't know how to use it, please YouTube it, or if you have other modes of getting that in your hands, if it's needed, you'll have it, because that's exactly what we use when we get on scene. Once we are on scene, we are there to help. We are not there to judge. So in the case something happens, please know that we're just there to help. And that's the very first thing that we use is Narcan. And you too can get that as well.
I appreciate that, Ashley. And so regarding Narcan, that leads into the next question for Crystal. Can you talk more about naloxone, or more commonly known as Narcan, How does it work? And then I can, ask a follow-up question to that once we have a better understanding of what Narcan is.
Absolutely. So naloxone, it's commonly known by its brand name, Narcan, right? And so it's a life-saving medication that can rapidly reverse the effects of an opioid overdose. Educating parents about naloxone is essential to help protect youth and young adults from dangers of opioid misuse, or just anybody, not just youth and young adults. What naloxone is it's an opioid antagonist, meaning it binds to the opioid receptors in the brain and it blocks the effects of opioids like heroin, fentanyl, and prescription painkillers. It is specifically designed to reverse the symptoms of an opioid overdose, restoring normal breathing and consciousness within minutes. When administered during an opioid overdose, naloxone quickly displaces the opioids from their receptors in the brain. This action reverses the life-threatening effects of the overdose, such as slowed or stopped breathing. Naloxone can be administered as a nasal spray or injected into the muscle, under the skin, or in the veins. The nasal spray is the user-friendly and can be used by individuals without medical training. The reason that naloxone is so important is because it acts within 2 to 3 minutes, making it crucial for immediate intervention during an overdose. It is available in pre-packaged nasal sprays and it's easily accessible. Naloxone has no effect. It's safe for anybody. So just as Ashley was saying, if anybody's not responding and they're not breathing, one of the first things along with CPR is going to be administering naloxone. It's safe. Even if an individual is not taking opioids, it's not going to harm that person. It's only going to work if it's someone that's suspected of an overdose, and it will be confirmed because that's what will help them start breathing again.
I appreciate you sharing that piece of, if you don't know if somebody is overdosing specifically from fentanyl or an opioid, still use Narcan because it will not hurt them if they are maybe they're overdosing from alcohol or cocaine or something like that.
I'd
Andrea?
just like to also throw in, if you have administered Narcan, please follow through with calling 911 and getting medical help and assessment. The way the medications work, it has a countering effect on the receptors to, kind of temporary displace the opioids that's in the system, but the naloxone is going to wear off relatively quickly. 45, 90 minutes, that naloxone is going to go away and the opioids are still going to be present in somebody's system. And if there's still enough of it, they can reattach to those receptors and send somebody back in to an overdose. So you're not in the clear just because you have had a person wake up and start responding. It's very important to follow through on care after the administration of naloxone and to, continue to stay with that person until we've seen that process through.
Also, one more thing. Please understand that you can give more than one dose. If you don't see a reaction right away, go ahead and give another one. You can't overdose a patient on naloxone. So give another dose, give us a call, us meeting 911, and we will come on scene. But don't be worried about giving more than one dose, please.
I'd like to throw in that as well. If you are in a group of people, please make sure that somebody calls 911. If you are not the person to call 911, because everybody will have their phone out filming it. Somebody needs to call 911. And if it's not you, then point to somebody and make sure that they call 911 because getting EMS there is they will have more Narcan. They will have Narcan, period. And so the other thing that I just put in the chat is if you do not have access to Narcan, rescue breathing. Please, CPR. That so many people know CPR. So an overdose is lack of oxygen to the brain. So at least rescue breathing is going to be getting oxygen to the brain. So please, if you have administered Narcan, that piece is very important. And if you don't have Narcan, that piece is very important. Make sure that somebody is administering rescue breathing. I also want to say for anyone that has children that are attending parties, whether you know that or not, that if you do not call on that someone dies from an overdose, unfortunately, anyone present that did not provide life-saving measures can Kelly, you're going to have to finish this statement for me because my brain is locking up. But
Yeah.
go ahead.
Yeah, they can be held accountable and face criminal charges. There is the overdose bystander law or the Jessica Sosa Act, which is in place to encourage help seeking and to help reduce potential criminal consequences if somebody does call 911 and they are underage drinking or they do have drugs on them. There are some kind of parameters that help reduce the likelihood of them getting in trouble criminally for calling 911 if they're actively seeking help. That doesn't mean, though, if they call 911, EMS comes, and then the caller starts fighting the paramedic, they start fighting Ashley or a police officer. Now, that is a separate charge, and they're not going to then be protected by the overdose bystander law. Ashley, go ahead, and then Ty.
Okay. Please understand also, if you do administer naloxone and they start fighting, actually fighting is good because that means that they're alive. So if they're combative, it's understandable. Some people have that fight or flight response, right? Some people fight once they wake up, but being combative, that's a good thing because at least they're alive to fight. And if they're not fighting, then you may need to give that other dose, the next dose, and call 911 if you haven't already.
Thank you, Ashley. Go ahead, Ty.
No, I was just going to address a question that was in the chat about Narcan and pregnancy, but Andrea got to it, which is to say that it doesn't seem to have adverse effects for the pregnant mother or the fetus particularly. And your other option is potentially to let someone be an overdose and die, which would then have obvious adverse effects on the fetus. So it's absolutely something that you want to use, even if you do suspect pregnancy. The alternative is much, much worse.
I appreciate that. Okay, so one other thing that I want to go back to that Deb mentioned in regards to calling for help, we teach this in our curriculum for 6th through 12th graders, is the person who sees the overdose should call 911 or they should designate a person to call 911. There is the group effect where, somebody's shouting, call 911, and we as humans think that somebody else is going to do it, and then it doesn't actually happen. So we want to make sure that 911 is called. So either someone is designated to call 911 or the person who sees the overdose calls 911. When they call 911, we go through a script with our middle school and high schoolers, but they're going to ask, the 911 operator is going to ask, do you need EMS? Do you need police? Do you need fire? You say you need EMS. They're going to ask, where is the emergency? So you give them the address. And then they're going to ask, what is the emergency? And you tell them what you are seeing. You are seeing that your friend is non-responsive, your friend is blue, they're not breathing, you can't wake them up. And that is going to escalate the call to, the top tier of this is a true emergency. Somebody needs immediate attention. So you want to make sure you are sharing what you are seeing and you're not making assumptions about what potentially could happen until EMS arrives and you have that conversation with them. So I'm going to go to the next question, which is for Ty. How can parents, teachers, and peers work together to prevent fentanyl-related harm among youth?
So I think I'm going to start at least kind of concentrating on parents. I'm a parent. I have a 16-year-old and an 11-year-old. And one of the most important things that you can do is, and this was mentioned by Deb specifically, start early and have frequent conversations about substance use. This is something that, kind of like talking about sex as a parent, is uncomfortable. And you may have a lot of reasons why you don't want to talk about drugs. You may not feel like you know much about drugs. You may not feel educated. Well, there are resources out there that you can find that will help you feel more educated and have a more productive conversation. You may feel a little hypocritical. Maybe you experimented with some things in young adulthood. Maybe you actually had more of a frank substance use problem in young adulthood, and you feel bad about telling your child not to use a drug. The thing I would always say there is that, especially if you do have a family history, those kids are at higher risk of developing a substance use disorder, and you can use that to warn them about the risks. But even if you never really had a problem, even if maybe you did some very light experimentation, it's really important for you to talk to your kids about substance use. It was a little easier for me because this is my area of expertise, but whenever I would see somebody vaping or smoking, even when my kids were 4 or 5, I would point it out and talk about how that was bad for their health and how it was potentially dangerous. If you have opportunities where you hear about somebody overdosing, you can bring it up with them, your children there. But it's something you've got to be purposeful about, and it's something you've got to do regularly. And an important part of it is to be really clear about your feelings about them using substances. You need to make disapproval really clear. You don't want to be vague about it. You don't want to kind of laugh about, well, everybody tries some stuff. That sends the wrong message. You've got to be clear that you, as parent, want them to remain substance free for as long as possible. And this is the conversation I've had with my kids is the earlier they start, the greater their risk is for a substance use problem. And the more they change the way that their brain is developing normally, the more it alters that normal brain development and then their normal psychological and social development. It makes it harder to get good grades. It makes it harder to be involved in sports and extracurricular activities. It makes their chances of going on to college or a successful career lower. As teachers, I think you can do the same sort of thing to make it clear how you feel about substance use. If you have an opportunity to do so, and obviously in a lot of classes, it's a difficult sort of thing to bring up. But if you have a stronger relationship with a student, that's a great time to do it. But one of the most important things you can do is have a conversation. And I want to be clear about a conversation is not you talking at your child. A conversation is you talking with your child about what they're seeing and hearing in their school, about what problems they may be experiencing, and about ways that you can help them prepare to deal with the eventuality that they will get offered a drug, even if it's just something like alcohol. They're going to be in an environment where substance use is going on. And in the same way that you can prepare to have this conversation with them and feel better about it, you can help them prepare by role playing, by talking about things that they can do in those situations to avoid substance use. And so those are the things we always recommend that the research shows are sort of best practices are to be proactive and have these conversations early and often with your children.
Thank you, Ty. And, I think to summarize that, like those consistent conversations, bringing the awareness, the education so that your youth, your students, your kids can make informed decisions when inevitably they are given that choice to make, right? They are in a position to make that choice. Deb, go ahead.
I just want to say two things that worked for me. If someone offered me something that I wasn't for me, was I'm good. It's not judgmental. It's not like someone say, "Oh, you want this?" I'm good. There's no, I'm not judging you. I'm not shaming you. I'm good. I don't need that right now. And that worked for me. And the other thing that I want to say about parent-child conversations is please don't just have the conversation about drugs. Like slip it into one of the other conversations that you're having with them. Because every time that you go to talk to your kid, they're going to be like, okay, she wants to know about drugs again. Like she's going to ask me about drugs again. And like, we don't want that. Like have it be a natural way that, or always having that open door policy. Like if you have something that you want to talk to me about, and I will tell you, as a parent having some very, very difficult conversations, when your kid wants to talk to you about something difficult and your reaction is like, oh God, what is it? Like, that's going to shut them down so fast. So working on your poker face, guys, really, I mean, it's just as much about us as it is about them, us being open to hear what they're saying and not be like, well, you don't need to hang around with that guy anymore. Like, that guy might not be who they're talking about. They might be talking about themselves. I've had a lot of kids come up to me after I've spoken somewhere and say, like, I need help, Deb. I don't know what to do because I can't get off of this. So when they're saying my friend, they might be talking about themselves. And if you have that reaction about their friend, you're actually having that reaction to your child about them.
I appreciate that, Deb. So I want to be mindful of time. I think that there's been some good conversation with questions in the chat. So please feel free to put any additional questions in the chat. But I want to give our panelists like 30 seconds to share anything else or any last pieces related to this topic that you think our audience members would find valuable. So who wants to start off? Again, 30 seconds, and then we'll jump into any additional questions. Andrea?
I'll just jump in. I know we've talked a lot about fentanyl. Fentanyl is treatable. There are resources, treatment, and support, even for youth out there. So please don't feel like, it's a losing battle. There are places to reach out and connect to. And most importantly, if you're not all carrying naloxone, then let's try and remedy that. I know it sounds like Dr. Clary's going to share some additional resources with where to get it, how to get it. It's available over the counter at all of your pharmacies. There's free options across the state and a lot of different formatting. So please make sure you have it. You never know when you may have that opportunity to save a life, or like Deb had mentioned, save 2 lives if it's dealing with the pregnant population. Like, you just need to have it on you. Even if you think, oh, I'm not going to encounter it, I'm not high risk, no one around me is using, you really do not know. And everyone should have it on their person, in their car, in their purse, in their backpack, wherever we can get it. It doesn't save lives sitting in a box in the office or in a warehouse somewhere. It needs to be out and about in the community.
I appreciate that. And I put in the chat, if you would like Narcan, if you need Narcan, please feel free to reach out. And depending on where you're located, we can make sure that you do get it. Ashley, Ty, Deb, Crystal, anybody want to chime in? Last 30 seconds.
I'll just jump in really quickly.
Yeah.
We've been talking today a lot about fentanyl, and my question was about what you can do to educate your children and keep them safe. Please don't just have conversations about fentanyl. There's a lot of cannabis and marijuana in the environment. Andrea talked about the 4th wave. Well, the 4th wave is opioids and stimulants. So there's a lot of stimulants in the environment. It's tough. There's a lot out there. And trust me, as somebody who even has expertise in this, I'm not always fully aware of what's in the community. And again, that's why you want to have a conversation with your student, with your child, not to them. But you want to talk about more than just fentanyl, because while it's certainly deadly if it's in a drug that they use, it's almost certainly not the only thing out there that they may be exposed to.
I appreciate that, Ty.
One thing I want to say is that kids cannot carry currently, I'll say that, kids cannot currently carry Narcan on campus because Narcan is a medication. They cannot carry any kind of medication on campus. That does not mean that they cannot carry it the rest of the time. So people have asked us about Narcan and temperature being in Texas. If you do have Narcan in your car, it will only degrade a small amount. Okay. So it's not best to keep it in your car. Keeping it in a backpack, keeping it in a bag that you carry with you. This is something that my kids both do. They carry Narcan everywhere that they go. They are both trained on how to use Narcan. Ashley mentioned you can just YouTube or Google Narcan, how to administer Narcan, and you can find that online. It's easy. It's easy, you guys. Please watch it with your kids. Talk to them about Narcan. If you don't want to talk to them about fentanyl, talk to them about Narcan. That's an easy, gentle conversation to have. And saying, like, anybody out there, not you, not their friends, they will know who needs Narcan. We can also, I will tell you, we can get Narcan for kids that need Narcan for their friends or family too. So carry Narcan. I think that's a big takeaway from this for you guys as well. Just because they can't have it at school doesn't mean that they can't take it with them to parties. I had a parent ask me, well, isn't that a big responsibility for a kid? Do you know what's worse? Watching your best friend die right next to you and having no control over the situation at all. Narcan is power, knowledge is power.
Thank you, Deb. So there's two questions in the chat that I want to make sure that we get to. So the first one is from Victoria, who works at Senecor. And she asked, our prevention site often gets asked, are youth at risk of fentanyl poisonings from smoking marijuana? What are your recommended responses to this question? I think this is a really important question. And I know that we saw recently in the news a woman from San Antonio dying, and then also somebody in Austin have fentanyl poisoning from smoking cannabis. So is there one panelist who can, answer this question in about a minute and 30 seconds? Because I want to make sure we get to the second question.
I can speak to it. I know I'm talking a lot, you guys, sorry. But yeah, I talk a lot. So something to think about that, and that question brings up a really good point, which is using two substances at the same time. So whenever that person was tested, we don't know if they got that from cannabis or if they also took something else at the same time. I think Ashley mentioned gummies. You can have gummies that are laced as well. So somebody might say, well, it's in cannabis, but actually that person might have taken cannabis or used cannabis and had a gummy, or used cannabis and taken something from the street like a Percocet. We see a ton of fentanyl in perks and meth. If your community has meth, your community has fentanyl, period.
Thank you, Deb. Andrew, I saw you unmute yourself. Do you want to add anything to that? Because I think the research is showing mixed data regarding whether or not if marijuana is laced with fentanyl, if it can be burned off when due to heat when it is lit. So can you talk about that, Andrea, or add anything to that question?
I was just going to kind of re-highlight what Ty had mentioned about how, it's not having a conversation about one substance over another, or I'm only here to talk to you today about fentanyl. I think there's a rising concern with cannabis use in general that probably needs to be a conversation in and of itself, kind of irregardless of whether fentanyl may or may not play a role. I know that it can and does pop up. It's been, found in all types of drugs out there, including cannabis. Now, whether it's more or less likely than, other pressed pills and things like that, kind of feels like that's a distraction from like the bigger conversation. You've got substance use here, you've got risk for a variety of reasons that may or may not also include that risk of fentanyl, and just kind of I really like Ty's approach of like, it needs to be a bigger approach and not just like, oh, I'm fine with it, but oh, that fentanyl, maybe you shouldn't do it. Like, that's probably not the message I want to get out there. I want it to be like, there's other concerns, especially with youth and cannabis use, that, should be part of this bigger conversation that can also include fentanyl as part of that.
Thank you, Andrea. So the second question was from Miriam. We talked about the presence of fentanyl in various street drugs. I'm curious on why doctors are still prescribing it when we know the adverse side effects like addiction or overdosing. So I wonder if Ashley or Andrea, either of you want to address that question?
I'd like to answer that question. There are different types of pain. One of the worst types of pain is neurological or neuropathic pain. There are people who have cancer where morphine will not touch it. It will not do anything for it. So there is a need for fentanyl usage. We actually have it as well on our paramedic units, because if someone has a traumatic break, a femoral break, any type of bone break. Also, we use it in the case that someone's having a heart attack or an MI, to stop that pain, because that's the only thing that will mitigate that pain. So there is medical necessity for it. But as far as, the makeup of it, it is something that is published, and it is something that can be found. Chemistry class or Go, all of those places are places where that information can be found. So there is medical necessity, but it can be dangerous in the wrong hands.
Thank you, Ashley. Andrea, did you want to add anything?
Yeah, I just wanted to throw in that a good majority of what's out there in your street drugs is not coming from your pharmaceutical companies. It's not coming from your doctor. It's not coming from the pharmacies. It is illicitly manufactured and trafficked in and being, kind of just permeating the landscape out there. So, Ashley is right on point. Like there's medical necessity and need for something like this, but unfortunately people have kind of taken advantage of that because it's a synthetic. It is, I don't want to say easy because I couldn't do it, but it's accessible to be able to learn how to, make something out of some basic analogs and create something relatively cheap, relatively easy, and be able to kind of push it out through all of the different trafficking places. And so I think it's important to keep in mind, it's not that the doctor is using it in surgery or post-operative care. Like that's not why we're seeing the greatest effects on the landscape. It's coming in from all those other illicit sources that are causing the concerns.
Awesome. Thank you so much. I want to be mindful of time. Do we offer education for the patients prescribed or administered fentanyl at hospitals? Ashley, I think you could probably take that question before we conclude. Oh, you're muted.
I was going to say I didn't hear the question. My apology.
Do we offer education for the patients prescribed or administered fentanyl at hospitals?
Yes, we do. The doctors, the hospitalists are supposed to do that. Also, the pharmacists as well are supposed to do that. The rounding nurses are supposed to do that. So there are different tiers and levels of people with education at all times. Also, once they're released from the hospital, their physician is supposed to also do education efforts as well.
Awesome. I appreciate all of that. So I'm going to go ahead and say thank you so much to our absolutely amazing panelists who had so much expertise and experiences to share. And I think, some things to take away from this presentation, this conversation, is to continue having this conversation with your friends, with your colleagues, with your kids, with your students, not just on fentanyl, but about substance use and related high-risk behaviors as well, so that we can get that education and awareness out and we can reduce stigma around substance use. And then the second big thing that I think we take away from this is to get trained on how to administer Narcan and to have Narcan on your person. And if you need help with any of that, please do not hesitate to reach out. I want to thank you all for your time today, and I'm sharing with you our post survey. You can QR code that on your phone. It should take about 5 to 10 minutes. Give us feedback on how today went, how we can improve, what other events you want to see in the community. If you do complete it, you will receive a $10 Amazon gift card. I'll stay around for a few minutes if anybody has any last minute questions or want to connect further, but I appreciate all of the panelists for spending their time and all of the engaged participants for being here and asking really insightful questions. I hope you all will stay in touch with us and have a great rest of your day.